Hello everyone, I am Dr. Li. Today I am truly grateful that you have come to Chinese traditional wisdom to sit down quietly with me and talk about the body and about life. Today is not really a lighthearted day. As everyone knows, the fire at Hong Kong's Tai Po, Wong food court, took away many precious lives and brought countless tears to many families. Those scenes in the news one after another. Even now, I still don't dare to look at them for more than a few seconds. As a traditional Chinese medicine doctor whose duty is to treat and save people, it truly feels unbearable. It's not only heartache for the injured, but also pain for society as a whole. Over the years, I have seen countless patients, but whenever I encounter this kind of irreversible disaster, I always feel that human life is truly the most fragile and impermanent thing. Those who left us will never again have the chance to return home, and the family members who remain must face longing and sorrow every single day from now on. They must carry their pain forward, and this is a wound that no medicine can fix. May the departed rest in peace, and may all who are injured, whether physically or emotionally, gradually recover. At a fire scene, the most deadly thing is often not the flames, but the high temperature smoke that causes burns to the respiratory tract. What looks like just a sore throat or a couple of coughs may actually hide a swelling airway and unseen injury. This is especially dangerous for the elderly, children, asthma patients, and people with chronic illnesses. Many fire-related deaths are not from burns, but from suffocation by thick smoke. This sounds cruel, but it is the truth. The temperature of fire smoke can exceed 200 degrees. Just one breath can burn your nose, throat, trachea, and lungs. The mucous membrane can become red, blistered, or peel off. The vocal cords can swell, and the airway can become so swollen that it is nearly blocked, leaving no space for air to pass through. Even more serious is deep lung injury that leads to pulmonary edema. This condition often does not fully appear at the fire scene but worsens after arriving at the hospital. The heat damage continues to progress. The airway keeps swelling, and eventually the patient may need intubation or intensive care. In other words, the danger of inhalation injury is that it can worsen within 1 to 24 hours. You may think you are fine, but the damage is silently expanding inside. Even more troublesome is that carbon particles in the smoke can remain in the lungs for a long time. Those tiny black particles are like sand stuck in a sponge. They cannot be coughed out or washed away. Macrophages try to engulf them, but they cannot finish the job. And some rupture, releasing the carbon again and causing chronic inflammation. Over time, this can turn into chronic bronchitis, asthma-like symptoms, pulmonary fibrosis, and even form lung nodules or increase the risk of lung cancer. In other words, this is not something as simple as, I just inhaled a bit of smoke. It may affect you for years. As long as you inhale thick smoke, you cannot rule out a burn to the larynx. Many people think it is just hoarseness or a sore throat. But these are danger signals indicating that the vocal cords or larynx are swelling and may suddenly worsen until the airway is completely blocked. A throat burn may not feel serious in the first few hours, but after 6 to 24 hours, as swelling increases, you may no longer be able to breathe. This is especially true for children and the elderly, whose airways are already narrow, and just a little swelling can cause complete obstruction. That is why we always emphasize, if you inhale thick smoke, regardless of how mild the symptoms appear, you must seek medical care. Do not wait for shortness of breath. Do not wait for chest tightness. Do not wait for dark phlegm. When you can no longer breathe, it is often too late. So, what symptoms require immediate medical attention? Hoarseness, persistent coughing, chest tightness or difficulty breathing, rapid breathing, a feeling of something stuck in the throat, black soot in the nostrils or sputum, a face or nose stained black from smoke. And for children and the elderly, they must be taken to a doctor even if there are no symptoms. These are all warning signs. Hospitals may perform laryngoscopy, nasal endoscopy, chest evaluation, oxygen therapy, steroids to reduce swelling, saline nebulization, and even early intubation to prevent the airway from suddenly closing completely. These things sound frightening, but they are truths that I must remind you of. This fire spread smoke over a wide area, and many residents, even those not at the scene, inhaled drifting smoke particles and felt unwell. Next, I want to share from the perspective of traditional Chinese medicine. If you only inhaled light smoke in the nearby area without exposure to high heat, and now have a dry throat, cough, or phlegm, this is when traditional Chinese medicine can help. In TCM, we see fire-related smoke irritation mostly as heat toxins injuring the lungs, dryness damaging yin, and phlegm dampness obstructing the lungs. The lungs are like a newborn, extremely delicate, most afraid of dryness, heat, toxins, and turbidity. Fire smoke contains all four, so of course the lungs are the first to suffer. After mild smoke inhalation, the throat may feel dry, like a grain of sand is stuck inside. Nasal mucus may increase, phlegm becomes thick, and some people cough nonstop. I have seen many patients who cough immediately after inhaling smoke, whether from kitchen fumes or from fire smoke, because the lungs are irritated. Lung qi cannot disperse, and bodily fluids are damaged. At this time, the most important thing is to stay away from pollutants, rest, and drink more water to reduce internal heat. Water is the simplest way to clear heat, but just drinking cold water is not enough, as too much can upset the stomach and weaken the spleen. In TCM, when yin fluids are damaged, we nourish yin, moisten dryness, and clear heat. That is why I often recommend dietary therapy to moisten the lungs. Since fire smoke attacks the lungs first, we start by protecting the lungs. The simplest method is snow pear water. Cut the pear into pieces, including the skin and seeds, and boil for 30 minutes. It tastes sweet and can quickly moisten lung yin. If you find this troublesome, eating a raw pear is also fine. But don't replace all water with pear water. It's best to drink half plain water and half pear water. Pears really can calm the dryness and heat inside the lungs, making them especially suitable for people with dry cough or dry throat. Ingredients like ladybulb, glehnia root, and polygonatum are ancient yin, tonifying foods that nourish lung yin and soften lung qi. They are commonly used to moisten the lungs and are very suitable here. After inhaling smoke, many people feel sticky phlegm in the throat, too thick to cough up or swallow. This is due to phlegm dampness obstruction. Tangerine peel, fritillaria, apricot kernels, and platycodon root are all helpful for thinning phlegm and opening the lungs. If you have dried tangerine peel at home, simply wash 2 small pieces and boil them for 30 or 40 minutes. Within a day or two, you will feel less phlegm and a lighter chest. But I must remind you again, these methods only ease mild discomfort. If you feel chest tightness worsening, breathing becoming difficult, coughing blood fever, or dizziness, do not delay. You must go to the hospital. Lung changes after a fire may worsen 6 to 24 hours later. Don't assume that being fine now means you are truly fine. After talking about managing smoke inhalation, I want to discuss fire scene self-rescue. This is the part I most hope everyone remembers. In TCM, we say the mind must remain calm. When the mind is chaotic, qi becomes chaotic. And when qi is chaotic, behavior becomes chaotic. In a fire, panic leads to disaster. The more dangerous the moment, the more your heart must settle. When you panic, your steps rush, your judgment slows, and you easily head in the wrong direction or make the wrong decision. The most poisonous thing in a fire is the smoke, not the flames. Smoke rises, so you must move downward. You cover your mouth and nose with a wet towel, not because it filters out all toxins, but because it reduces how much you inhale and gives you a few more seconds to escape. Never open windows because airflow can make the fire stronger. Some people see smoke and immediately think of taking the elevator, but this is extremely dangerous. If the power goes out, the elevator will stop, and if the doors open right onto the fire floor, thick smoke will pour inside, leaving no chance of escape. So when fleeing a fire, always use the stairs. Always remember this. If smoke is too thick and you cannot see, crawl on the ground. Even if you cannot see, do not run blindly. Keep your hand on the wall and move along it. Air near the floor is better, and that can save your life. If the stairway is blocked, do not force your way forward. Running into thick smoke will only make you inhale more toxins. If you cannot escape, return to your unit. Seal the door cracks with wet towels or tape, and go to the window or balcony to signal for help with the towel or bedsheet. These may seem simple, but are life-saving techniques. After a fire, people are injured not only physically, but also mentally. In TCM, we say the heart governs the spirit, and such immense shock easily injures the mind. Many people who experience a fire later develop insomnia, light sleep, heart palpitations, nervousness, or nightmares. These are not exaggerations. They are real psychological after effects. At this time, try to relax emotionally. Take a warm bath, drink lily and lotus seed, soup to calm the spirit and tonify qi. Practice deep breathing, take gentle walks, or meditate to settle the heart fire. If poor sleep or nervous tension persists for a long time, you must seek medical help and not force yourself to endure it. Physical recovery is equally important. After a fire, immunity decreases and the body is under stress. You must drink enough water and consume adequate protein and vitamins to repair damaged tissues. Avoid spicy fried and grilled foods, which worsen heat in the lungs Eat more light soups such as lily and lotus seed soup with lean pork, or glehnia and polygonatum soup, which nourish lung yin and benefit vital energy. After your body gradually recovers, you can start light exercise. Walking and gentle stretching help regulate breathing and allow the body to metabolize the remaining smoke toxins. Finally, I want to say that fire is truly cruel. It does not warn you when it comes. And when it leaves behind only charred remains and trauma in the heart. This fire in Hong Kong is something no one wanted to see, but it reminds us that fire prevention is not someone else's responsibility. It is homework for all of us every single day. Is the wiring in your home old? Is your hallway cluttered? Do you know your escape route? Have you practiced it with your family? These things matter far more than how nice your dining table looks. I hope every citizen of Hong Kong can walk out of this shadow soon. And I hope all residents in every city can truly remember the lesson from this disaster. We only have one life, and safety does not give second chances. This fire used the most brutal way to remind us that fire prevention has never been someone else's job. It is everyone's responsibility. We never want to encounter disaster, but if it truly comes, at least we must know how to protect ourselves and our families. If you patiently listen to this entire sharing today, I sincerely hope you will keep these things in your heart. And I also hope you will like and share this message. Perhaps one day, a small action of yours may unknowingly save a stranger's life. May everyone be safe, and may the light in every home forever remain a warm glow, never again taken away by merciless flames. You are also welcome to share your own fire prevention tips or escape experiences in the comments, so that more people can learn from them. These experiences may save more lives than you imagine. Wishing you peace and smoothness in life, and may your heart and lungs remain tranquil. May we all stay far from disaster, safe and healthy. Thank you.